Hello everyone, Dr. Kimball here. I am coming to you, just got back from Straubing, Germany this week, actually yesterday. I spent the week out there operating with a colleague, a friend, and I would say definitely a mentor, Dr. Bertignoli. He's a German orthopedic spine surgeon who has basically carved the path for disc replacement, invented some of the earliest and most commonly used devices that are out. So his experience is something that I find super valuable and want to kind of sponge and take all of that stuff and apply it to my practice so that I can offer the benefits that he's learned, the tricks and tips and theories of disc replacement, implantation, indications, trying to apply the art of medicine for my patients so they can do well. I'm going to share a couple little snippets from that visit, and I wanted to just kind of tell you a little bit about why I'm doing this. This is really nothing new for me. In fact, my training is here in the United States in neurosurgery, but I also did orthopedic, so that's in neurosurgery. I also did an orthopedic spine fellowship in Australia. I have a colleague out there and definitely a mentor, Matt Scott Young. He's another kind of, in my opinion, global epicenter for disc replacement. He's done more disc replacement in that country than anybody else in the country, and I've learned a ton from him. In fact, I've flown back to Australia at least 3 times in the last 5 years to operate with him, and this is my second trip back to Germany, so finding people who are the best at what they do is nothing new for me. And the reason why it's important, one, I'm very, very passionate about it. I also realize that even though I think I'm really good at what I do, and I hopefully project that to my patients and bring really good results and care to them, I also realize that there is a huge path that's been carved before, and there's a lot of experience out there that I should learn from, and my patients should definitely benefit from that. And I don't think it takes anything away from my skill sets. So just a positive thing. What I learned this trip was really focused mostly around lumbar disc replacement and kind of the most common things around getting suboptimal results with disc replacement in the lumbar spine. And without getting too complicated or techniques and all these little things that I've taken copious notes about and videos and pictures and all that stuff that I can bring back to home is really the idea that success in disc replacement surgery in the spine, cervical or lumbar, is based on unlocking mobility, unlocking mobilization of that disc, because the last thing we want to do is take a disc that is dysfunctional and is losing motion and then put a disc in improperly such that we don't actually get the motion back. So the idea that just because you have a disc replacement means that you have regained motion is kind of false. Every human body is built differently, much like a car. If you put the products in improperly, you're not going to get the right results. And so the disc replacement, placing it, remodeling the surface of the bone to fit the disc, maintaining the right angulation, so that the actual joint can function and can get full range and flexion and extension. There's a lot of nuance to that, and I'm really excited about it, what I've learned, and how I can make some minor tweaks and modifications and be even better disc replacement surgeon and provide unlocking motion to my patients in a more predictable way.